This is another secondary IOL-related chronic hypotony case, this time after a sutured IOL. On gonioscopy after injection of a small amount of viscoelastic. What is going on here? Is there a cleft? Is there some angle recession? Is this related to the IOL haptic, or perhaps is it just a red herring? What would the UBM show? As with other recent secondary IOL-related hypotony cases, the UBM showed that all the action was happening behind the iris. There seems to be a communication between the vitreous cavity and the suprachoroidal space around the IOL suture. How do I fix this hole without disturbing the IOL suture? Please watch this space to find out what happens.